Have you ever met some clients, they are not suitable to do longevity or anti-aging projects, and you decline them, even they are willing to pay?
A lot.
A lot.
Yeah, it's a very hard decision to make, but we once made that at the end of the day, we are responsible for our clients' health. So we cannot see them as a machine of generating cash.
Basically something like there is no kind of magic, pill that can solve every problem.
Not at all.
Yes. Just like you already mentioned that you have done a lot of comprehensive assessment before the real treatment come to the clinic. So we are very curious, when you do a systematic diagnosis to a client, have you ever met some clients, maybe they are not suitable to do some sort of longevity or anti-aging projects, and you decline them even they are willing to pay?
A lot. Yeah, this is the thing. This is the fact. This is very hard to say, but when you are a longevity hospital and also you're a business and a private business, it's a very hard decision to make. But we once made that at the end of the day, we are responsible for our clients' health. So we cannot see them as a machine of generating cash. So we are not here for a short-term period, so we want to perform in this market for a decade at least. So for us, our client safety is the most important thing. I can say there were a lot of clients that they really wanted to do some specific treatments like TPE, like any other treatments that we have here, but because we do a comprehensive assessment before, we understood that it can have a risk for them, so we declined them. Even they were very motivated because they heard it from a podcast or they saw it in a YouTube video or they were following someone's protocols, but it was like, okay, again, longevity starts when personalization starts, and this treatment is not the best treatment for you to have because, as you may know, human body is the most complex thing that we have right now.
Yes.
And still, we are not very sure of some of the new treatments which come in. So we are committed to provide the latest science and latest research in this field, but it should be evidence-based first. Secondly, it should be good for our clients to do them. At the end of the day, as a healthcare providers, what we need to take care of is their health. Even if they don't know, is that it can, for example, that intervention can cause a serious problem for them, but we know that, so we decline.
Perfect. And that's basically something like there is no kind of magic pill that can solve every problem.
Not at all.
Yes.
Anyone who claims this, it's like it's like specifically, especially in the industry which is not that much regulated, you can have this kind of claims easily. But till the moment we are talking together, we do not have any specific aging biomarker. You can just say, okay, this is one biomarker I measure, and I can say how old how biological age is. There's not any specific biomarker till now, and also there isn't any magic pill, or there isn't any magical treatment that can reverse everything in a very fast way without side effects. So this is a good thing also, that in the era that we are living, because of the AI, because of the enhancement in tech industry, we can now understand and we can integrate different data to understand what is going on and have a very clear roadmap to what to do next. And also we can do lots of measurement to see if it's working or not. But still, there isn't any magic pill to solve all the different things and without any side effects.
Yeah, we can see you are very strict about this whole process of diagnostics and treatment. So we are curious about when you are adapting, some kind of new technologies like stem cell, gene therapy, something like that, when you are adapting it into your system, what's the core principle or criteria? What's the whole process you decide whether or not to adapt it into your, an intervention system? Can you give us some examples?
Yeah. So first of all, this question can be vary in different economies and also different health policies. For example, the UK regulation is one of the hardest regulation ever, and technically we like that, because it's like, okay, I can understand it's not that much agile, but also you can understand it's safe. So first of all, as I mentioned, because we are a hospital, we need to have a huge regulatory process for approving any of the treatments to do, and we need to do that first. Second, we need to make sure that evidences behind that treatment, even there are lots of things that they have lots of evidences behind, are the kind of evidences we validate. And third, we need to make sure that with all of those things, based on the diagnostic test we did for our client, it's the best intervention we can give to our client, because there is a chance that even it can happen in the pharma industry that the medication has lots of FDA approval, has lots of regulatory behind, but for one specific individual it can do a very massive reaction. So this is a thing that when personalization starts, you need to make sure with all the things and all the science behind, also it's good for your client, that individual with the specific demands and also specific body each of us have.
So we noticed that you are utilizing some kind of ICU grade equipment in your hospital. So in the next 3 or 5 years, is there some kind of new areas, something like biomarkers, some new biomarkers you are considering to incorporate into your system?
Of course, even not in the next 3 or 5 years from now. I can say that we have different diagnostic panels, and if you want to compare it with for example 3 months ago, you can see lots of enhancement in our diagnostic portfolio that we had. So when it comes to diagnostics, I think it's way better and also way easier to apply it, because at the end of the day there are some diagnostic things that you already know. You can do the calibration, you can see how much accurate it is. So for the diagnostic test, before going to the devices, for a diagnostic test, I can say every month we replan our diagnostic test, because there are lots of new tests coming in. Also, there are lots of new biomarkers that reveal that, okay, this can give us a good insight about the cortisol. Instead of doing morning cortisol or cortisol curve, now we can use this biomarker, or there are lots of new things that coming in. But when it comes to the device, so we have our own business development department who we need, and also we have our own research and development department. So there is a good partnership between these two departments to see the trends. And when you see a trend, you need to follow the evidences behind which institute is supporting that, what cohort they are doing that, and based on the stage of the cohort and also based on the forecasting of when it will be finalized, then we can do that, okay, if we want to have this in our program or in our clinic or not. So one thing that we always say, we are pioneers in longevity, but also we are very committed to safety of our clients, and make sure that this can be a good example of how longevity medicine can be evidence-based and also can be something that really transforms our clients' body and health.